I'm Dr. Paola Alberti from Università of Milano-Bicocca, and our main objective today is to tackle down the concept of gamification, exploiting the virtual tools that are part of the Metis project, but tailoring our conversation on a very specific field, which is human anatomy, the subject I'm in charge of at our institution. For the Metis project, your opinion matters. So please, you can see here on my slide the QR code that will be again visible at the end of the presentation. It will guide you to the survey we are using to understand if our lecture and in general overall the project is somehow satisfactory for you. As I mentioned, today the main objective would be to understand what gamification is. First of all, it's always better to start from very basic concept and then build up your knowledge. Then, taking into account the fact that digital tools are becoming part of human anatomy teaching, we will exploit this specific field of knowledge to understand how gamification can be embedded into teaching activities. And last but not least, I will share with you our experience at Università of Milano-Bicocca in a pilot phase in which we are starting to use gamification as part of the syllabus. Let's start from the definition. What is gamification? The word is pretty self-explanatory, I think. Pretty much it describes the fact that we are incorporating a game-like approach in a non-game context to deliver, to boost the teaching activity. The aim is to deliver something that is engaging and can somehow bring students as main actors of the learning process. We need to, therefore, find ways to make our lesson as interactive as possible. As in any game, there will be strategy to increase the gratification, so rewards, rankings, prizes are part of this concept. You can apply gamification even to, let's say, approaches in which digital tools are not mandatory, but as we will see in our discussion today, digital tools, of course, are so much flexible and customizable to be ideal to bring gamification into our classrooms. To reason with, let's say, a more robust theory behind our words, we can refer to some works of literature. For example, I picked for you this editorial that is focused on gamification and that describes what it is and, moreover, why it matters. What can change, what can ameliorate in training healthcare professionals, but also in delivering the best care possible. Let's say that now I'm trying to describe the gamification concept, not only thinking from the perspective of a student, neither of a professor teaching something in medical field, but also trying to step into the shoes of someone who has a technological background, so to speak, and is able to deliver the app, the platform for gamification. So potentially all the people interested by the concept of gamification would be receiving some precious information. In fact, if you want to build something that is relevant for the gamification purposes, these are 7 key elements that should be brought into the discussion. First of all, it's pivotal to set a goal. It's like a soccer tournament. The goal is to win. So if you give a goal, you focalize the activity and you make it, let's say, funnier. Moreover, the fact that you are overcoming a challenge will promote growth, learning, and develop some behavioral strategies and changing. To guide the process, giving a feedback is pivotal. Therefore, when you embed a gamification approach in your teachings, and when you are experiencing as a student a gamification approach for you, it's important to know, okay, I scored 1 out of 10, 5 out of 10, what was wrong? And we see how, for example, a group exploited AI to build a virtual assistant to give you a feedback. Of course, feedback is one part of the story, but reinforcement is, of course, something that you should keep into the framework of the gamification approach, because if you gain a reward, like points, avoid a punishment, that in this case would be a negative score, nothing else, you can make the experience more similar to a video game you might be playing just for fun. Another important aspect to be taken into account is the opportunity to compare progress. So you can you can monitor your progress as an individual, but you can also compare with others to, let's say, bring competition a little bit on the table. But not only competition in a negative sense, it will also boost social connectivity, because gamification activity can be built in a kind of team environment. Therefore, team building is part of the experience potentially. And last but not least, our limbic system does like fun and playfulness, and this aspect is for sure part of gamification. All these strategies are able to modify changes to make not only the experience funnier, but even more impactful. For example, as you can see, if you set a goal, you are creating a kind of contract between the instructor and the people competing for the goal, and the goal setting is changing the behavior, and the same goes for all the variables. But gamification is something that you need or you can embed if it's suitable to your, let's say, framework, talking about your teaching activities, or even other potential actions that you are delivering, for example, for the general public, because you can teach with a gamification approach even to lay people. Anatomy can be, for example, a subject you would like to share with people that are not getting any medical education, but to boost knowledge in the general population. And with gamification, it's far easier to grab their attention and have them on board for the entire boring lesson of 45 minutes as it's gonna be today. So to balance from a technical point of view how to tailor your approach, this author very cleverly suggested many aspects that are to be evaluated. The intervention user, the user social context, the psychological and behavioral outcomes that you are being pursuing, and also some theoretical information about cognition should be taken into account. But I'm not gonna go too much into details about this, because it's more about education than just describing visual tools and embedding them in anatomy for gamification purposes. What is more relevant for our conversation today is about the tactics to make gamification a potential feasible option in a medical training course. Providing clear goals, offering a challenge, giving different level of, let's say, difficulty, as it is in video game. You have the newbie and you have the pro max level expert. Giving points, showing progress, providing feedback, rewards, creating a team, maybe with the game leader, or giving a story and the theme are all tactics to make this approach a little bit more appealing, because just throwing a random quiz to have a tournament inside the framework of a lecture is not enough to have gamification if there is not enough planning before you actually get to deliver this activity. However, if you reason on the methodological aspects that I try to summarize very briefly so far, it's evident that in medical education, game-based learning is becoming an option. It's more engaging, more effective, and as this article is cleverly addressing, it's engaging and effective, not only for students, also for instructors, and even for patients, provided we are delivering education to them. I would say that I share this opinion. I am myself an instructor, and when I rely on gamification approaches, even for me, it's funnier, it's a better experience than just having a lecture in which I'm giving tons of information. In this way, I can interact better with students and guide a bit more a personalized, tailored approach to guide their learning. This game-based learning, let's say GBL as an acronym approach, has gained more and more interest. As you can see, I'm relying on pretty much recent literature. This one is from 2023, and it provided an overview of what is happening. They reviewed what was done in the past and so published it in literature, and many of the options that were presented there are in line with the Metis overall theme. So digital tools, VR, AI. In fact, you can see that the majority of the options were online games, electronic questionnaire, and similar approaches, even if in some other articles, I wouldn't say the majority, the minority, board games and card games were also an option, because technically gamification doesn't equal virtual tools. Virtual tools are an option to deliver this approach that frankly is a bit more convenient, being flexible and quite more modern. In the past, the approach of gamification, according to this revision the authors provided, was embedded into different fields. As you can see, anatomy and / physiology was also a potential field, but all other fields in medicine are enlisted. So it's not something only for anatomy. It's something you can tailor next morning for your lecture in microbiology, emergency, psychiatry. A very flexible and powerful tool. However, it's a new tool. It's something that we are introducing, and it's a field that is evolving very, very fast. The question we should ask ourselves is that impactful? Is that enough? Is the method appropriate? The reply is that we do need robust evidence. After all, we come from evidence-based medicine. At least I was trained like that. So when I adopt a new tool, I want to see how effective, how robust, how impactful it is. Therefore, these authors conclude that it's important to design actual research, let's call them experiments somehow, to detect if GBL is really what we would like it to be. And we will see that I've picked a few research studies building up quite robust evidence that thankfully we are on that trajectory. Let's see, in fact, what this very interesting systematic review was able to underline for us. Once again, pretty recent, 2021. And they reviewed literature. So reviewing literature, a systematic review, means very formally checking everything that was out there already published to understand how much robust is the evidence up to this point. The findings, as the author is already summarizing, were that actually it seems that gamification is able to change the behavior, meaning also towards learning. So I have a different behavior towards learning thanks to gamification, and some benefits can be expected, but once again, they reinforced the fact that more research and robust evidence was required. As you can see, it was a very formal review. They started from a number that is quite large, 5,000 They screened, they had criteria, and in the end, they had 44 articles to build up their, let's say, reasoning. The conclusion was that gamification is promising. The main theme that emerged was satisfaction. So students were quite glad to receive this kind of teaching, but what was not done in the study were how the gamification was actually embedded, how it worked, so more robust theoretical and technical matters were to be addressed, and therefore future research was deemed as something reasonable and needed. And we will see that in human anatomy specifically, studies doing exactly this are available. In fact, let's step into the field I'm a little bit more familiar with, so human anatomy. If you were connected to my previous lecture last week, we already discussed together how now we have virtual tools, virtual platform, specifically to deliver dissections, even if real bodies are not available. Therefore, the teaching area related to anatomy is already undergoing an evolution. Digital tools have been embedded into curricula, into syllabi, but digital tools are one thing, gamification another story. Let's see how we can put them together. This is once again quite a recent perspective on how anatomy education evolved thanks to digital technology. In particular, augmented reality, virtual reality were part of the, let's say, tools that were considered, something that once again is in line with the theme of the Metis project. But what was even more important is to start to validate if gamification was doing something relevant and building up better curricula. In this case, I'm presenting once again a pretty recent article, 2023, that was somehow analyzing both gamification and artificial intelligence to see if they were able to deliver a new model potentially more impactful for their students. Overall, we can summarize that they try to investigate how delivering human anatomy classes via a gamified technological tool was potentially something boosting the learning curve of their students. They embedded this approach into two different departments, and they had quite a large number for an exploratory study such as this. 131 students were included, and please note that they used the word experiment. So there was an experimental component to demonstrate if the intervention was impactful, similar to what you would see in a clinical trial or in a preclinical experiment at the bench side. So they had two case studies to deliver this kind of reasoning. As you can see, thinking about the fact that among you there might be someone on the technology side, so able to build the tool to deliver a gamification lecture, they present how their platform worked. First of all, there was, of course, a digital platform with a welcome introduction that gave a quite detailed overview. There is a nice homepage where they can start from. But another information they were very consistent in highlighting was that they had a virtual assistant that was able to guide the student or the students in case it was delivered as a team. And as you can see, the reward aspect we mentioned previously was embedded, since medals, according to performance, were very clearly delivered as a possible outcome of being able to correctly perform the activity. Another relevant point to be addressed was that to reinforce teamwork skills and even to boost even more engagement, the tournament approach was an option. So people were not just doing activities by themselves, they were divided into teams, competing one against each other to have a ranking and a final winner. Last but not least, as I already mentioned, there was a virtual assistant that is quite relevant, so you can have feedback during your activity. Another aspect that we deemed as very important to make sure that the gamification approach is not just time put aside from the classical lecture, but time well spent to deliver a more advanced and more impactful teaching activity. You can see that the platform was pretty straightforward in the format presented. The main buttons are shown here. This is a picture taken from the article itself, so pretty much you have an idea of the interface the students were interacting with. So I would say pretty much user-friendly, with a chat with the assistant and even the option to communicate as a community. Pun not intended, of course. They were very consistent in delivering the results in what was an experimental approach that was double. First of all, they rated some items. Secondly, but not second for importance, they also demonstrated if there was an impact on the, let's say, learning curve of their students. The elements they were aiming to rate, to gauge, to score were relevance, origin, transparency, novelty, and serendipity of their platform. So relevance is a question that they asked students to understand if they find helpful to know how I will perform in the subsequent course evaluation. The origin, the virtual assistant explaining why I got the performance prediction. Transparency, which is very important. I understand the information the virtual assistant gave me about my succeeding assessment. Novelty, the recommendation for improving my performance seemed new to me. Serendipity, the recommendations were varied, supporting improvement of my performance. So I just tried to summarize the kind of aspects they were suggesting students to rate for them. And each gamified component of the platform used in this study was rated for different aspects, once again: design, learning, usage, usability. All are quite relevant, I would say, items that are pivotal to be very well tailored when you are building up your own app platform. So all these, let's say, aspects, if you are an IT person, are quite relevant if you want to build up the next best tool to deliver gamification in anatomy or in any other medical field. As you can see, there are two acronyms for the two different institutions who were able to provide students, and all the students from both cohorts rated all the main aspects I've tried to summarize for you. And pretty much what we can see from this table is the number of interaction the students had that in the mind of the authors was quite good, but the information that I think is even more interesting is the overall evaluation of the recommender system using scores from previous evaluation. So you can see the items that I described for you previously: relevance, origin, transparency, novelty, and serendipity, being actually rated by the two different cohorts. In this case, they are showing us the, let's say, positive score. So at least agree or totally agree by the percentages that you can see now I'm pointing at. are pretty high, so they at least agree or totally agreed, rating the score. So overall, I would say the perception was quite good. But also in this other particular table in which they gave rating of the performer recommendation, once again, you can see that the majority of the score were pretty high. So the satisfaction was something that pretty much they gave as a good option for this approach, this tool they were provided by their institution. The other, again, questions that were once again asked about the challenge, the chatbot, the tournament, the community, the ranking and tutorials. Everything, once again, both for learning support and usability, was given pretty good results. But let's see the actual point here. That was a comparative analysis, so the even more experimental component of this approach. The pre and post experiment difference, so to measure the impact that the gamification had. To understand the picture, let's have a look at the tag for each color. UFRO and UC, once again, are the two different institutions. Blue would be pre-control, orange pre-experimental, gray post-control, and yellow post-experimental. So two different, let's say, cohorts, control, blue before and gray after, and the experimental arm, orange, yellow, pre and post. You can see that there is a boost and an increase. In particular, they tested pre and post experiment knowledge comparison of abdominal and lower limb muscle. The main findings led pretty much to the conclusion that the Gamify component was able to boost what students were trying to learn. Usability and satisfaction were particularly high ranked, and therefore students who used the application had a higher score, less diverse respect to the control group, potentially showing that gamification was actually ameliorating the learning curve. The virtual assistant, so that AI tool that was there to provide feedback and guide, was also something that was rated. It enables students to address some aspects, but overall, the authors concluded that to increase the use of gamification, some personalization, type of device should be considered, and therefore this is the starting point of quite a long process. For example, once again, it's not so trivial to consider even the device you are using, the platform, how user-friendly it is, but it is expected that building up even more, let's say, tailored approaches might boost knowledge quite well. What I will try to do now, after I have presented to you what other people did in general for gamification, what they did specifically for human anatomy with an approach that we discussed so far. Now I would like to address what we are doing at our university. If you were connected for the previous lesson, I apologize because I'm repeating maybe some information you are now familiar with, but I'm addressing them in case someone wasn't connected. I am presenting you the reality of the Department of Medicine and Surgery at University of Milano-Bicocca. The University of Milano-Bicocca, even if it's named Milano-Bicocca, doesn't have the medical campus directly embedded into the Milan city. It is located in Monza. You can see here the hospital, San Gerardo Hospital, and these are the buildings, U8, U18, U28. that are part of the medical campus in Monza, a city not far from Milan. Here, we deliver human anatomy teachings for all healthcare professional degrees, so not only medicine and surgery. And pretty much the majority of our courses is delivered in Italian language, but we also have a second medicine and surgery course that is international and delivered completely in English language. On top of that, we also, of course, deliver human anatomy teachings in the training programs, and in all these, let's say, possible environments, so to speak, we are able potentially to embed gamification. However, in this pilot phase, I'm presenting to you what was done in the international course in medicine and surgery. It was deemed as the ideal course in which to start a gamification strategy as part of the curriculum, just for a logistic reason. So we started simple. You can see that the Italian course has now 180 seats, whereas the international course has 50 seats. This is me in the anatomy room. What we tried to do in the past few years was to, let's say, change how we deliver the lectures. So not just a PowerPoint slide deck, but we are using a table for virtual dissection that you can see I'm operating right now in the photo, which is reproduced on 2 screens over the wall, very high quality, so students can perfectly see what I'm doing. Therefore, we have embedded this digital tool. And this was the first step. Gamification came a little bit later. In general, the teaching structure of IMS, which is the acronym for the course delivered in English, is ideal to embed those strategies. First of all, because the number of students that you have in a class is no more than 50. And also, the structure for teaching human anatomy is quite different. One, let's say, consolidated approach in Italy is to deliver human anatomy teachings in the first years of medical education. So a very large amount of information at the start of your training, and then you're done. Instead, and this is the horizontal track approach, technically speaking. In the international course, instead, the approach is slightly different. During the first year, students receive a course that overall is named as Fundamentals of Human Morphology. So anatomy is taught, but not in depth, as it would be for a course that would be the only one you get during the 6th year of the medical degree. Later in the training, they do have boxes, let's call it like that, named as vertical tracks, that are divided by topic. For example, they have a vertical track about diseases of the gastrointestinal system and a track for neuroscience. This is the one I'm focusing my attention with you today. For example, for neuroanatomy, they receive some teachings, some basic information during the fundamentals of human morphology during the first year, but then they receive another more advanced 30-hour course during the 4th year. This course is embedded in the vertical track, named as neuroscience. So pretty much the story is that students already know anatomy a little bit, and they get neuroanatomy, a very solid and robust course, then physiology, pathology, diagnostics, semiotics, treatment, and so on. Therefore, it's a very well-balanced let's say, course in which they start once again from the basics, anatomy and physiology, and they reach the point to understand how to treat their patients. Gamification is quite ideal to be embedded into this kind of course. As well, it is flipped classroom, the topic we are dissecting together next time. Because at this point, students are a little bit older, more experienced, they know already something about anatomy, so I'm able to tailor my lectures far more easily than it would be for a first year. In fact, today I'm trying to describe to you how we were able to embed the gamification approach in this course, the neuroanatomy course I was relating about just a few moments ago. Each teaching period is divided into 4 hours, so pretty heavy, I would say. And the students at the time I'm discussing this, there were only 36, and they were divided into teams in order to boost gamification and exploiting the, let's say, tournament approach. And gamification approach was embedded into the breakout sessions, so to speak. That meant that at the start of the lesson, I delivered a frontal teaching, so me talking and dissecting the cadaver, the virtual cadaver. Then the class was broken into different groups, and each group rotated into different activities, and one of the activity was to use the table under the guidance of the professor, also building up a tournament. So students had a quiz to test themselves on topics that were revised previously. Moreover, to understand if there was pretty much an impact on the activity we were doing together, I relied on a QR code that enabled me to have some multiple choice questionnaire to detect, grasp how impactful the activity were. In fact, the idea was that the class was doing 3 different tasks when divided into groups. One was actually performing the gamification approach at the table. Another option was to be at the desk and exploit the broader platform of the table, which is online, anatomy lesson, and then paper copy exercise, because I wanted to compare 3 different approaches to digital, one with gamification, one not, and the paper copy exercise. Therefore, I had students to rotate among different activities and options to give them the full experience. During the last lesson, the winning team was elected because we are relying on digital tools, and the tournament that you deliver via the table is able to grasp the score of each group, not only the number of wrong or correct answers, but also the time. So in case you reach a tie, you pretty much are able to deliver the name of the winning team. But I also wanted the students themselves to have a sense of how much that could have been impactful. As I mentioned for you before, they already received a neuroanatomy more basic course during the first year, so they already knew something. Therefore, at the top of the first lesson, before saying a word, they had a QR code to scan and some questions to test their neuroanatomy knowledge. At the end of the course, they retook the questionnaire to see how they ameliorated or not, but they ameliorated thankfully. And since I'm not alone in this process of tailoring as much as possible the learning experience, I also asked their, let's say, rating of the activity that I decided to add in that specific course to understand if it was the correct trajectory, it wasn't, paper copy exercise were better, or something else. Using the virtual approach in general, both with and without gamification, was able to help them to understand relationships among structures. It makes sense since it's a 3D virtual tool, and also shapes parts and positions. Compared to a regular textbook, I would say that no one rated less than 7. That for us, it's still a good score, with the majority of the scores in the higher portion of the curve. So it was a good news. I wasn't doing something that was not relevant for them, given that I was shifting from a more, let's say, historical approach, just talking about anatomy, switching to a more modern approach with these 3D dissections. And once again, the using directly, that was referred both to gamification and not, was quite relevant for them, I would say for the majority. So This is one of the things of gamification. It's not the professor doing something, it's the student being the protagonist of the action. Therefore, consolidating experience learning was far easier and potentially more long-lasting. I also wanted to check if platform, which was meant to be a solo experience with no gamification apart from some quiz to be filled after each session, was relevant, and pretty much they liked it. What was also rated not so bad was the paper copy exercises. As you can see, it's getting in this picture a few scores below the threshold that I consider as a good result, 7, but not tremendous. That's why, as we will discuss in a few minutes, it's an option I'm still using. And the tournament itself, how relevant was for them to compete one team against one other and to finally have a prize at the end. I was really surprised to get this score because I was a little bit concerned. You come to the class, you expect the professor to give you in a very elegant, tidy manner all the information, and maybe you do not expect to be yourself doing something. So I was asking myself, would they like that? Would they not like that? Would they think we are just losing time? So it was for me very important to understand if the tournament, which was the pivotal element of the gamification approach, was somehow perceived as useful. And I would say no one gave a score below 7, which once again is my threshold to say, okay, that's nice. But the majority gave a very high score. The median score was 10, with Q1, which was the first quartile, 8.25, and Q3, of course, a 10. So it was a solid number that made me quite happy, first of all, because it meant that the action was pretty successful, but also, once again, useful, because the actual point is, okay, it's funny, so probably you like it, but is that useful for your learning? That's the actual question we should be very careful about. The other aspect that I wanted to check, as already mentioned for you, was if there was a kind of effect on their learning, their retainance of information. This was an assessment that was a self-test, and it was not performed after they studied for the actual exam, so that should be somehow weighted in our reasoning. But as you can see, before taking the course, so the first day, before I even started discussing anything with them, overall, correct replies reached at 64%, and 25% of the questions were answered correctly by only 45% of the class. So they pretty much recalled information, but not perfectly. I delivered my course. All the topics were revised with this, let's say, more engaging approach, gamification embedded. And once again, the students, self-testing, were replying to multiple choice questions to see how much they now recalled about neuroanatomy. In this case, quite a boost was visible, 64 before, after. 85% of students correctly replied to all questions, and 25% of all questions got a correct reply by the entire class, and the question with the lowest performance, meaning not being able to pick the correct answer, was correctly answered by 83% of students. Therefore, this is a pilot, exploratory, but a very good result in my opinion. So once again, I had numbers saying to me, okay, students think the activity is useful, previous slide, but also it's potentially impactful because they are recalling a bit more of what we discussed together. There is another note that I would like to make about this. Let's go back to the question that I showed you at the start of this conversation. As I already discussed, the aspects that they felt to better grasp with a 3D gamification approach were relations and shapes part position, which I think are quite crucial and pivotal and not so easy to be understood and recalled about neuroanatomy. Therefore, the questions in the self-test before and after the course were meant to explore exactly those kind of domains. That's why I was quite happy to see there was an amelioration in the trajectory overall, specifically for those aspects that are not so easy. If you are familiar in any possible way for neuroanatomy, for example, I challenge you right on the spot to perfectly assign with no hesitation the spatial relationship and position of the caudate nucleus, the putamen, the globus pallidus, the thalamus, and the third ventricle all together where they are respect to the, I don't know, corpus callosum. And I think that via this gamification, having them play on the 3D object, actually was able to boost their understanding of all these complex aspects about human anatomy. What I'm doing right now, this academic year, is to copy and paste this approach to other courses. So this year, I'm embedding this approach also in the first year course, is the regional anatomy course. Of course, they are first year students, so they should be eased a little bit more into the topic, but I'm trying to have this approach in order to, once again, exploit the gamification approach to at least give a chance to information to stuck forever in their brains. But that vertical track approach I mentioned for you before, it's not only for neurology, it's also done for all the other topics. So I have other courses, and this year I started to use a bit more, or I would say far more, the gamification approach in other vertical tracks. There is a course named as Human and Child, and there, during the 6th year, we describe into more details female reproductive system / normal anatomy of the newborn baby, and gamification was embedded. Starting from this year, also the digestive health vertical track embedded this option into the anatomy of the digestive system. Last but not least, we have a second table that is now freely available in the library. The tournament, the gamification approach I mentioned for you today, is something the professor can tailor, can build up, creating some presets. However, the table itself already has some quiz mode activities that are already there. So students can go there and test themselves in this, let's say, more engaging, funnier way to verify if they understand. And sometimes, even if you don't know, by playing somehow, you are able to discover new things about anatomy. And to boost this, let's say, exploitation of the table, we are fostering a peer-to-peer tutoring program, which will be the topic of the next lecture that Università of Milano-Bicocca is delivering for the Metis project. I hope that I have not bored you to that, and that somehow I've given to you some information about gamification. If you are students, if you are instructors, if you are people building the next app, I hope that I was able to show you which are the meaningful approaches, and specifically what could be done for human anatomy, taking into account literature data and or our experience. As you can see here, there is a very big QR code to be scanned. We would be very happy if you could scan it and give us your feedback that is pivotal to tailor all the Metis activities and to ensure that we are doing our best to, let's say, land results that would be impactful to the medical education field.